Hello everyone, today I will be talking on Cyclospora cayetanensis. Out of the 20 species belonging to this genus, this is the only one which is able to infect humans. So this is the outline of my presentation, and without further ado, I will begin. Cyclospora cayetanensis, these are small, spherical, obligate intracellular coccidian parasites that infect the intestinal walls of its host. It causes cyclosporiasis. This is an illness which infects the intestines and affects humans through a fecal oral route via the ingestion of contaminated fruits and vegetables. Moving on to its epidemiology, cyclosporiasis usually leads to diarrhea, and it is common in tropical regions where sanitation is poor, one of which, as illustrated in red above, is Peru. In addition to this, high cyclosporiasis cases have been reported in the United States, which may be attributed to imported fresh produce. Moving on to its classification, it belongs to the kingdom Protista, the phylum Epicomplexa, genus Cyclospora, and species Cyclospora cayetanensis. Next, I'll be discussing the clinical manifestations, which may appear after an average incubation period of 1 week. So the symptoms are similar to that of a flu. This can make it difficult for clinicians to identify the causative agent without running any laboratory tests. So symptoms include fatigue, nausea, headache, low-grade fever, along with watery diarrhea. Next, I'll be discussing the pathogenesis in brief, since it is similar to that of a life cycle, and then once I discuss the life cycle, I will discuss it in detailed form. The invasion of the intestinal epithelial cells causes diarrhea. Additionally, infection can be serious in individuals with a weakened immune system, one of which is HIV-positive individuals. Now I'll be discussing the life cycle of Cyclospora cayetanensis. So when Cyclospora oocysts are first passed in stools, they are not infectious. This is because they are still unsporulated. After some time outside the body, which can be days up until weeks, these oocysts, they undergo sporulation to form sporocysts and become infectious. So sporulated infectious oocysts, they enter the environment and contaminate fresh produce and water. These oocysts are ingested when we eat contaminated produce. Once they're in the body, they move to the gastrointestinal tract, whereby they release sporozoites that invade the lining of the small intestine. While in the intestine, they multiply into type 1 merons and type 2 merons. So type 1 merons, it undergoes asexual reproduction to produce type 1 meron along with type 2 meron. However, type 2 meron, it usually undergoes sexual reproduction to form a zygote. So the microgametocyte, which is the female gamete, fuses with the microgametocyte, male gamete, to form the zygote, which develops into the unsporulated oocyst. This unsporulated oocyst, it is then released from cells and ends up in our stool, which is excreted during excretion. So next, I'll be discussing the laboratory diagnosis. There are various tests that can be done to detect the presence of oocysts in feces. However, I've only managed to pick out 3. So the first one is polymerase chain reaction. This is a molecular testing method that has the ability to detect parasitic DNA. Next is light microscopy. So fecal smears are stained using Ziehl-Neelsen stain. Ziehl-Neelsen, it is known to detect acid-fast organisms, one of which are oocysts. So oocysts appear pink to deep red. The third laboratory diagnosis method is microscopic examination, which looks for oocysts in stool under a microscope before staining. Next is the treatment methods. The affected individuals are usually treated with trimethoprim and sulfamethoxazole, which is an antibiotic administered over the course of 7 to 10 days. However, if this is unavailable, ciprofloxacin can be administered. These are both antibiotics that are given to individuals to help them with their diarrhea. Although most healthy people recover without treatment, it is essential that they are treated, because if left untreated, a relapse can occur. While learning about a microorganism along with the diseases that it may bring about, it is very important that one learns about the prevention or control methods that can be taken to prevent its reoccurrence. So the best way to avoid exposure to Cyclospora is to avoid food and water from unsafe sources. Any foods that must be eaten raw, they should be thoroughly washed before consumption. In addition to this, it is important that good health practices and sanitation is maintained by washing your hands after using the washroom and before preparing food. Now we've come to the end of my presentation. So to conclude, Cyclospora cayetanensis is a protozoan parasite causing cyclosporiasis primarily through contaminated food and water. It is prevalent globally, but mostly in regions with inadequate sanitation. Prevention usually focuses on improving sanitation and safe food practices, while treatment with antibiotics like trimethoprim sulfamethoxazole effectively alleviates symptoms. It is essential to continue creating awareness on this microorganism along with the diseases that it may cause. This aids in preventing cyclosporiasis and ensuring safer food supply along with better health outcomes. So here are my references. If you have any queries or if you wish to read more on this topic, thank you all for listening. I hope that you have gained insight on this particular parasite.